You're listening to Beat Autoimmune and Thrive, the podcast all about reversing and preventing autoimmune conditions so you can live your most vibrant life as soon as possible. We talk about autoimmune root causes, actionable solutions, and inspirational healing stories. I'm Palmer Kippola, and I used to have MS. Today, I'm an author, a speaker, a functional medicine certified health coach, a pickleball player, and nature lover who's helped thousands of people reclaim their health and their best lives. Let's dive into this episode. I'm delighted to welcome you to Dr. Lisa Brent. She is a naturopathic physician. She has a master's of science in Oriental medicine. She's a licensed acupuncturist and functional medicine practitioner. She's also a holistic gynecologist, imagine that, and hormone expert who specializes in helping women to resolve hormonal imbalances, whether they're dealing with fertility issues, autoimmune challenges, or women who just want to optimize their health naturally. Bottom line, Dr. Brent is always seeking to ask the whys behind illnesses and how to utilize our body's natural abilities to heal themselves. She's also my personal doctor and one I adore. She has a big heart, a big brain, and a beautiful ability to merge the art and the science of medicine naturally. Welcome, Dr. Brent.
Thank you. Thank you, Palmer. I'm going to record that intro and play it every morning for myself.
I love it. It's all true.
I'm feeling
it's all
really
true.
Good about myself all of a sudden. Thank you. And thanks so much for having me.
We are so glad you're here, and not a moment too soon, since people have been bursting with hormone related questions. And you know, I serve a big audience of mostly women with autoimmune challenges. You know, most of the people with autoimmune issues are women. That's not to exclude men, but that's to say there are a lot of women that are looking to seek healing. So let me give you some context to get started.
Okay.
We did a basal body temperature challenge for 5 days last week, and people tracked their waking and their afternoon temperatures. I know it's a complicated arena, but my understanding, my base level understanding, is that when temperatures are consistently low in the morning, say below 97.8 to 98.6 when they wake up, that could indicate that people possibly have hypothyroid issues. But when their temperature goes up maybe 0.5 degrees or more in the afternoon, that maybe that signals an adrenal issue. So I'd love to know what your thoughts are on that in general.
Yeah, that's really interesting. And it's a really practical tool. And I'm glad that you and all of your group is doing that, because that's something that you can do, you know, on your own, and starts to get you in touch with what's happening on the inside. Yes, I would say for sure that morning low temperature is a good indication for functioning thyroid function. And in the afternoon, that does make sense. I just would throw in there that, you know, first of all, yes, how you interpreted that is in general can be very accurate. I think some variables, and that really would depend on age, hormonal status, so many other factors in health that regulate temperature are estrogen, progesterone, insulin even, and blood sugar regulation. There's a lot of influences on our internal thermometer. But in general, yes, you have gleaned good data from those observations.
So one question that keeps coming up is about adrenal fatigue and people who are feeling tired but wired, and the general sense that, you know, when their thyroid function is going down, their cortisol is going up. What do you do in terms of treating the adrenals alongside thyroid? Is there anything specifically besides stress reduction practices that you recommend?
Those are important, but I think it is good practice to address the adrenal function kind of more specifically, and also, if necessary, reproductive function. You know, for women, it's those three legs of the stool, right? Our thyroid, adrenal, ovarian hormones. Those are the kind of the bases of our hormonal function, for almost everything that we do. And so if one system is starting to tilt for any reason, then you do have to address the other two. And actually, and even the cause can be found in some of the other symptoms. So whatever you're doing for thyroid, whether it's herbs, medication, whatever it is that you're doing to help support thyroid function, would also highly recommend using something for the adrenals, whether that's, yes, all the lifestyle practices that are so important, maintaining steady blood sugar, so not having glucose spikes during the day, and then possibly some herbs, which, we call those adrenal adaptogens, things like rhodiola, ashwagandha, Siberian ginseng, sometimes maca. And often you'll find, in fact, the makers of Nature Thyroid, which is a common thyroid replacement medication, the only two other things they make are an iodine formula and an adrenal formula, just because of that well-known close relationship.
Yeah, that makes total sense. So it sounds like you advise herbs and things, but it's a comprehensive approach. You can't just look at any two hormones like thyroid and adrenals by themselves in isolation, that you want to also check maybe your sex hormone status. Is that what I'm hearing?
If there's indication, if symptoms indicate that there's something going on in that system, then definitely, again, it really depends on what the presenting or the dominant picture is. But yeah, you're going to want to look at them all and then maybe decide where the focus is. If it seems to be that this, like the thyroid imbalance seems to be, probably mostly maybe triggered by some deep adrenal fatigue. Maybe there's been a big life stressor or an illness or some kind of a trauma, and it's really obvious, and then thyroid kind of went off after that. Then, that it's the history and the bigger picture that'll tell you maybe where to go first, but eventually you're going to want to do it all. Ovarian hormones, maybe that's dependent, but definitely the adrenal and thyroid, you're going to want to address them both. You're going to have more success that way. Because otherwise you can just kind of be chasing, right, with whatever you're doing for one system, and then it's not quite working. So maybe you're increasing your dosing, you know what I mean?
Yes.
But not quite getting there. So
yeah, that makes perfect sense. So thank you for that overview, because I think that helps to set the stage, and we can drill into some more specific questions, and then we'll probably come back to the overall picture because it's just so important. So somebody asks, let's see, we talked about temperature, so I think we can bypass that one. Do regular doctors or like your PCP, your primary care physician, can they run comprehensive thyroid tests? Or is this the domain of holistic doctors?
They can run them, right? They're, from regular labs, LabCorp, Quest, whatever they're doing. All of those tests are available. The question is, will they want to, or do they see, is that part of their paradigm of investigating hormones? And that's really practitioner dependent. There are some primary care doctors who really, they've done some functional medicine training, or they understand the value in looking at the bigger picture, antibodies, the free hormones, the globulins that carry the thyroid around, all of that. But in general, I think it's, as of today in conventional medicine, your thyroid panel is pretty much going to be a TSH, or a thyroid stimulating hormone, which is the most commonly run. If you're a part of Kaiser, that's probably all you're going to get, unless you really push for it.
Yeah.
The good thing is, if it's something that you want to address, like those are labs that they're pretty inexpensive to do, through, like, you probably can arrange for that through some of the co-ops and so on. So it's not out of reach to do that further investigation, or there's blood spot kits that you can do at home. So it's if you don't have access directly through your primary care, that doesn't mean you can't get that information.
Yeah, that's great advice. And are there typically 6 markers that you look for when it comes to thyroid, now that we're on the topic of tests?
Yeah.
Is that accurate?
Is that right? So I can list them really quick if that's helpful.
Sure.
So TSH, of course, free T3, free T4, TPO, which is thyroid peroxidase antibodies, antithyroglobulin antibodies, which is the other autoimmune marker. And then I really like to look at reverse T3. So probably that's a good full a full thyroid panel.
Perfect. So that people are aware of that, they can write that down. They could go to Life Extension. There are many labs that people can run on their own. Just do it. It's, there's no excuse not to be able to do this really. If you're a woman, I mean, we need to know more than TSH. That's a late stage thyroid marker, right?
Exactly.
Okay.
And you can really be missing, because ultimately, if your TSH is off, then we're still curious about the why, right?
Yes.
Is this an immune issue? Is this another hormone influence? Reverse T3 is a great indicator of a chronic adrenal stress or chronic infection. So that can be a great clue as to why, if your reverse T3 is elevated anywhere, I'd say above like 12, that tells us that you have a high level of a hormone that's putting the brakes on your normal thyroid function. And so just treating that, say with like levothyroxine or something, may not really help with your symptoms.
Got it. So you said it indicates possible adrenal stress or infections or both?
Yeah, kind of the two main ones would be elevated cortisol will drive up reverse T3, which of course is a result of a chronic stressor usually. And then the other cause can be a chronic infection. So
yeah, quite
that whole category. Yes.
Common. It's a huge category, but something that I think you're talking to an audience of people who are dealing with chronic stress and chronic infections. So that is a beautiful pearl to look out for. If your reverse T3 is above 12 and you're stressed and your cortisol is elevated perhaps, then you want to dig deeper into the adrenal stress and infections. I love that. That is a gem. So let's say there are imbalances on this thyroid panel and a woman wants to work with their doctor. Who can they go to? Do they have to go to a holistic doctor like you for natural thyroid medications? Or do you know if conventional medicine is embracing natural thyroid treatment? Or are they just limited to the synthetic T4 medication?
And I think it's changing, I think we're going to need maybe another wave or two of medical students, and I think so. Give us maybe 10 years. I don't know what you think, but because I think you'll find, even I have patients who are in Kaiser, and so they come to me for the things that Kaiser can't help with, but then we'll start some things, and then they might go back to their Kaiser doctor and say, I'm doing really well on this Armor thyroid or Nature thyroid, and can you prescribe it? And sometimes they will. Or same with a regular primary care doctor, that they're aware of natural desiccated thyroid and they'll be willing to try it. The general kind of standard of care still is using levothyroxine or T4 only. And so, that's probably the most common response, but you'll definitely see more. And that's just in primary care. Sometimes the endocrinologist, if someone has gotten that far and they're working with an actual hormone specialist, they might be more into the nuances of using other forms of thyroid, which is always nice to see.
Yeah. So what is the downside of using the T4 only medication from your perspective?
Well, our thyroid gland makes T4 and T3. So using T4 only, what we rely on biologically is for some of that T4 from the gland to convert into T3 at the cell, right, and become the active form of thyroid hormone. It's T3 that kind of does a lot of the job of metabolic function and clearing out the cells and, keeping metabolism on track and giving us energy and so on. So if we give T4 to someone, sometimes it's fine. So I'll just say that. Sometimes that's all you need, right? Like my grandma was on T4 for her whole life, it's perfectly fine. But if there could be other variables, say someone isn't an efficient converter of that T4, which is what you might find on a lab test, right? If you get those free levels and you see that they're really out of balance, you can tell that some of that T4 isn't converting into the active T3. Well, you give that person a lot of T4, nothing might happen. Like perhaps the TSH will come down, but they're not going to feel any better.
Yeah.
So if we're talking about bioidentical hormone replacement of any kind, then giving T4 and T3 in a ratio like the gland makes just gives a more support and can actually allow you to keep your dosage lower, right? Because you're actually getting what the cells can use right away. So it's more of a match.
Yeah, that's perfectly said. That is. So those are clues. If you're on T4 only medication, like say the name of it again,
levothyroxine is the generic. Yeah.
Right. Yeah. So if you're on that and you're still not feeling energetic, or you're still feeling cold hands and feet, or your hair is falling out, or whatever the symptoms might be, then maybe it's time to dig a little bit deeper and maybe consider working with somebody that can provide more holistic support for the thyroid. Is that?
Yeah, definitely. For sure. Yes. And if that's not possible, then even just asking your doctor about adding some T3, which can also be given separately as a separate medication. You know, if you're already using medication, so you're at that stage, then that's another option, is you can use a T4 plus T3. It makes it 2 pills, but at least you're getting some of both.
Yeah.
Sometimes. The other thing I'll throw in there is, and I know this is true in the United States, maybe not in other countries and other medical symptoms, but there is a difference. This is one of those cases where where if you're using Synthroid but getting the generic, where the brand actually makes a difference. That's one of those little pieces that I've seen over and over again. A lot of times with medications, doesn't really matter, whatever the insurance will cover. This is a case where I've seen patients who we make the case to get them onto the brand, and it's a total game changer, even at the same dose. So that's just also something to just plant, as a possibility for anybody who's in that situation.
That's great. So brand matters in the case of your thyroid.
Sometimes not, right? But insurance doesn't like to cover the brand. You have to kind of make a case for it. But I've actually had some patients who just ended up paying the difference out of pocket, and it was so worth it to them. So
I love it. I love it. So we're still on the thyroid here because we've touched on the idea of elevated antibodies. And there are, in my research, I have understood that about 90% of hypothyroid is actually Hashimoto's thyroiditis. So autoimmune hypothyroid, and that maybe 10%, and I would fall into this category, who don't have elevated antibodies, but are still suffering from hypothyroid. So I wanted your perspective on what are the ways that people can tell that they have Hashimoto's. So for those who are not familiar with the antibodies, and for those of us who fall into that 10% category who don't have an identifiable autoimmune disorder, but their thyroid is sluggish, how do you go about, is that a conversion issue? And what would you have us consider?
That's a good question. So first of all, the distinction between Hashimoto's or not is that's pretty much a lab. Like that's, the biggest clue will be in the lab testing, right? If you're having an abnormal TSH or even a normal TSH, but a lot of hypothyroid symptoms, and there are elevated antibodies of either thyroglobulin or TPO, that's labeled the Hashimoto's, right? Even if, and those antibodies can be slightly elevated or very elevated, but that's officially an autoimmune or Hashimoto situation. So that's just as far as diagnosis, right? That's really where lab testing can be helpful. If there is still a hypothyroid but without antibodies, then there's a few scenarios or what I see. If this is postmenopausal, like, 50 beyond, I sometimes will categorize that as just like a glandular, like the ovaries, our glands are a little tired, right? It's like we've been on the planet, we've been working hard, we've been,
Yes.
and so the adrenal glands kind of decline in function, the thyroid gland gets, the ovaries are kind of getting to be done. And because of the interplay between those systems, they all kind of take each other down a bit. However, but the thyroid gland will continue to function for the rest of your life, and you'll still have the adrenal function even when the ovaries retire. But sometimes we just see that, right? And we can come to that conclusion after we've ruled out other things like an autoimmune situation, after other hormones have been stabilized, adrenals are really supported, perhaps the estrogen, the reproductive hormones are being supported in whichever way we're doing that. Lifestyle is good, environmental toxins have been accounted for because that can be another cause of hypothyroidism, heavy metals, mold, chronic infections, all of those things. If we're lucky enough, right, to be able to investigate all of those things, and still we are left with a gland that is just, wants a little help, then sometimes I'll just feel like that's okay, right?
Yes.
It could be genetic. You might find that all the women in the family have had some kind of hypothyroidism. We may want to make sure that there's no thyroid nodules. So a thyroid ultrasound might, if that's an option, because sometimes you can have really benign little growths in the thyroid, that just take up space and don't and don't make any hormones. So that just impairs numbers. So I don't know if that answers your questions, but sometimes
it does.
And so then we just treat it because at this point, if all of the other health is optimal as much as where we want it to be, then we just want you to function well. And we want all the benefits of good thyroid function for the rest of your life.
So I guess my question there would be, so what if mold and toxins have not been investigated yet, right? I mean, it's a conundrum because there's so much to it. And yes, stress is part of the picture. Do you ever do you can treat the thyroid while making those changes and so forth? Because I know ideally we want to address all of these. I call them fights in my book, and it's a whole host of things, right? It's your foods, the infections, poor gut health, and all of it. But will you not treat someone unless they're doing all of those things because you see that the thyroid hormones won't be effective? Or is it a prerequisite, or will you go ahead and just say, let's just add this to the mix?
If a patient is suffering, right, if they're really not feeling well and not functioning well, then absolutely we will treat it while we're looking for the underlying cause, right? We want to always do both, right? Quality of life while we keep digging, because ultimately we'd like for patients not to have to stay on medication, right? Or be able to. So for sure, like that, we can do that even as what we call like a bridge. If someone just needs something to help, make it through so that they can even do those investigations or make those lifestyle changes. It's very hard to do if you are not able to get out of bed and think clearly and, so you, and that's a place where a little supportive medication can be really kind of life-changing. And then our goal, is to stabilize it and then do what we can.
Right.
It's a lot. And sometimes it's just not possible to address it all, and certainly not all at once.
Yeah. So. Yeah. That makes perfect sense. So appreciate that. And this ties in perfectly to this next question that came in. How can I know I have Hashimoto's. How can I heal it, come off of my meds, and feel great? So this is somebody that understands that we need to explore root causes. It's not just you don't have a deficit or a deficiency in medication, right? I mean, we know that these are not actually even thyroid problems to begin with. Autoimmunity is an immune system problem, and most of your immune system is in your gut. So we have to think about all of those underlying root causes. And from your perspective, do you have success with women healing from Hashimoto's? And if so, what do you see?
You actually answered the question already for me. That's a big part of it. It's great. Yes, it is an immune issue. So looking there, right? Gut health, other impacts on immune modulation, right? Like whatever we can identify that's affecting immune function is really where our lens is, not so much on the thyroid gland.
Yeah.
And so, yeah. And yes, I have seen women be able to bring their antibodies down and eventually get off medication. It's really, it's a commitment to do it, right? To really look at diet, really removing, food sensitivities, really, really working on gut health, healing leaky gut, getting rid of GI inflammation, really repairing the microbiome where so much of our immune regulation is happening. Looking for other influences on immune, like anything else that might be impacting the immune system, right? We talked about, chronic exposures, infections, and anything that's kind of messing with you, right?
Yes.
To use the non-scientific term.
Yes.
Because it could be, yes, that the thyroid gland is just where this is showing up. Your body chose to, right? Like go kind of get your attention there versus ulcerative colitis or chronic migraine or something else.
That's right.
Shown up. So that the thyroid it's your warning light, but not necessarily the root cause, as long as we've checked that route, that nodules and that kind of thing.
Yes.
So yes. And I've seen people do really great. And then we'll use their antibody levels. We'll check them maybe every year just to kind of as a monitor, right? As long as they're feeling well, but we'll see that. And I usually feel like once they get down to below, below 100, maybe around 50, even though that's still a lab abnormal, I think that's still really pretty good. And then we can even watch them, like maybe they'll go back onto some of their trigger foods or something. You can watch them go back up, which is telling, but long way of saying, yes, you can.
That's great. And so hopeful,
Yes.
But here's another question, because people who have or don't have autoimmune thyroid are wondering, how often should they get their hormone levels tested? Is this something you do twice a year? What do you optimally, what would you like to see?
Yeah, optimally, I think twice a year is great. If you're using medication, at the start, say maybe you're starting some, or not even medication, maybe just treatment. Maybe you found an elevated TSH and you want to use herbs or something, another way to address it. You're going to want to wait at least 6 weeks from any changes that you make. TSH is a little bit slow to change. So you don't want to check it too often, because then you'll feel like what you're doing isn't working and you have to raise the dose and that kind of thing. So minimum of 6 weeks if you're tracking a treatment protocol. And then, maybe at the 3-month mark. And then if you're also feeling well, everything seems fine, then yes, every 6 months, I think makes sense. If things have been stable for a long time, then sometimes we'll go to a year, but I wouldn't let it go, especially around the time of perimenopause and menopause, because thyroid can kind of sneak up on you as other things start to change. And it's, in a way, it's kind of an easy thing once you know what to do for yourself, right? It's an easy thing to make changes to or to regulate. So you don't want it to fall off of your ideal range of normal.
So you just made me think of a new question to throw in the mix, which is, when should a woman do, and I'm going to ask about men too, because I know women are probably 80% of the Hashimoto's issue, but men are in there too. I am seeing more and more men with hypothyroid. I think it's becoming epidemic. How young can you be, or should you start testing?
Yeah, that's a great question, actually, because sometimes we'll look at it in children, even, if there's like developmental delays or some growth issues, or some women who are having, cycle problems in their teens. We'll look at it. I think it's always something to throw into blood work, honestly, right? It's just, it's not that far out there. It may not be something you're going to address, but it can help with the picture of understanding what's happening. If there's any sort of metabolic hormonal clue in the clinical picture, I think throw it on the panel.
Easy.
So yes,
you just have to remember to ask your doctor to run those 6 markers on your thyroid panel. And that is very much up to the person, the patient, to be proactive in asking for it.
Absolutely. Yes.
Okay. That's very, very helpful.
And in a young person, even if you can just get a TSH, that'll at least be something. The rest is always ideal. But as far as like really checking it out to see, like, could that be a contributor? I don't think there's too young of an age. It's just, I guess, where the dividing line is like, would you do something about it in a teenager or somebody who's still growing? I'd say in the 20s, right? If there's some things that are happening, like, wow, I'm just not feeling, quite like I used to, or I'm putting on weight, or my periods have gotten odd, or
somebody's trying to get pregnant.
I was just going to say, exactly. We've been trying, not exactly. So I think it should be part of any general workup of any, kind of any symptoms that are kind of not quite right.
Great.
Yeah.
All right. Let's move on to this one. There are people that would prefer to take glandulars to medication. Do you ever see that being effective? And if so, can you recommend anything?
Yeah, I do see that being effective. I'm a little bit cautious when there is an autoimmune picture. Sometimes I've seen patients who do have high antibodies and a lot of immune triggers. We might see other allergies and things. And I'm reluctant to use animal glandulars with those patients while things are very activated, because sometimes they'll react to those. It is, it's another kind of foreign substance that, while the idea makes sense that we want to help to correct your own glandular function, it can just be something else that the body's having a hard time reading. So I'll be cautious at the beginning with that if there's antibodies. But in general, if it's just like we're just trying to kind of gently correct thyroid function, or even adrenal function or ovarian function, glandular treatments can be amazing. Place. I don't know. Can I mention?
Please, I wish you would.
People use, like here, people use Standard Process as a common glandular, company. They have very clean sources of their glandular products. For thyroid and adrenal, I've seen people do really well with something from Gaia Herbs. They have something called Thyroid RX and I think Adrenal RX, which they do contain some glandulars and some other nutrients, and they've been wonderful. I'm sure you're familiar with those.
Yeah. Very clean products.
Yeah. Yeah. So yes, for sure. Just with caution, if there's any possibility of reacting. And that's
right.
Where, like, ironically with autoimmune, and especially at the beginning, that's sometimes where I hate, from a naturopathic point of view, this is like where I don't normally go, but sometimes it's a synthetic medication that makes the most sense at first, because it is super clean. Right? It's just
interesting.
Made in the lab, right? It's just, there's nothing added. It's just thyroid. And so we might even use that temporarily and then transition into like a T3, T4 product like Armor or Nature Thyroid, and then even onto something that's just, nutrients and glandulars. So
I love that. I hadn't heard that before. That is beautiful. Okay. So I've got a new question, and this is a little question. Okay. Little teeny tiny question. I can't lose belly fat. I'm tired by 4 p.m. and I honestly have zero sex drive. What can I do? I think this woman is speaking for so many.
That's the question of, yes, that's a big one. And that's such a good one. So
where do you start?
I think you're going to want to look at all of it, right? Like, this is a great opportunity for like a salivary hormone panel, which someone can do at home. I think these things are available online. You can do it with a functional practitioner, but I don't know for sure, but I think these places like Everlywell and so on, like, sell these things where you can do a saliva kit that measures 4 measures of cortisol through the day, your estradiol, your mean estrogen, your progesterone, your testosterone, and your DHEA. It's what we call like just a salivary hormone profile. And what's great about that is it will track cortisol production through 4 samples through the day, and then take 4 samples of those hormones and give you an average, which is going to be more accurate than any single blood test reading that you might do at any time of the day or part of your cycle. So I would start there and just see what might be off, because belly fat is often an indicator of elevated cortisol, but also, and then other lab testing would be helpful to see where are insulin levels, glucose, right? Like, because we accumulate belly fat when our body's in a state of conservation, right? Which can be due to insulin resistance, also due to elevated cortisol. When cortisol's high, we're storing up because the body doesn't know, right? Like, is this high because of a famine or because, I'm just in line at Costco or right? Like it's the same physiological response. And over time, that elevated cortisol, which is those receptors are very high around the belly. That's the highest number of them we have.
Really?
You'll really start to accumulate there.
Oh, geez.
So we're going to want to know that.
So I just want to add to that because I just thought about this. The reason we call these obesogens in our gut, in our belly, because it's like they're holding on to toxins because your body is brilliant and it's trying to keep you alive and it's going to do anything it can to keep you alive. And when you've got excess toxins like these floating around estrogen metabolites that might be harmful and you're not getting rid of them properly, right? Or it's the BPA because you're using plastic or any number of these toxicants, including Roundup, atrazine, glyphosate. I mean, the aromatization there, that turns male frogs into female frogs. I mean, that's the same process that creates man boobs, right? So let's just be frank about this. This is a problem in men and women.
And young girls, right? With the early onset of their cycles.
At 10 or before. I mean, unbelievable. So this is a conundrum, but it's also, so if you're holding on to toxins in your belly fat and you've got high stress and you've got, your insulin is all over the place. And we've already discussed the fact that your insulin doesn't just go up because you're eating poor food. It can go up when you're stressed.
Sure.
Your blood sugar, right?
Yeah.
So how do you then nudge that belly fat? Is it a process of you've got to calm down? You've got to bring down your stress levels, sleep better, all of it? Is this all
part of it? Yeah. Maintaining healthy blood sugar, which I know you guys, you talked about probably before, but like low carbohydrate, good healthy fats, protein at every meal and snack, giving keeping your blood sugar from doing these kinds of spikes, right? Also, so it's a big picture, and which is why kind of figuring out what are the bigger players, because maybe this is happening to someone who really has a great diet, right? It's not so much related. Maybe it's not environmental toxins. Maybe we know, we've investigated that, but it's still happening. All of these things there can be a little bit of a lot of them, but what's the dominant piece? If you at least start with the hormones, you can kind of get a clue, right? And it's also a way in. The other piece I will throw in there, if this is happening to a woman who's, late 40s, 50s, or post-menopause, testosterone will also really decline during that time, which, if I think libido was part of that picture, if you mentioned, so that's a little bit of a clue that, if you think about it again, it's back to that loop. Cortisol's high, not the best time to procreate, right? So we're just going to turn that whole chemical cycle off. Libido will drop. And then when testosterone gets low, and which women do make testosterone, but this happens to men too, we're less likely to make lean muscle mass. So even if you're exercising, you're not going to build muscle or lose weight very easily if testosterone's low. So that's, so if we can kind of get a good snapshot of what's happening in that category, it's a great place to start. And then kind of figure out how to work our way out of it. Like the things
I love it. Yeah. Dr. Pedro and I are frequently looking at, I think there's a couple of labs. Labrix is one. I know ZRT provides some really good hormone testing. So there's some options and people can find this online, but that 4-point salivary cortisol, you can do it at home. It's a saliva
you do the whole thing at home.
Do the whole thing at home.
And you get a picture. Yeah, it's your active hormones. And, we'll often find, right, like cortisol might be very low, which is probably a result of it having been too high, or it's too high at night, which causes some of those night waking and so on.
Okay. So we got to kind of march through the other questions because we've got a lot. And I know we could go on for hours here. So 2 women are waking up every morning at 5 a.m. and can't fall back to sleep. Any quick advice on that one?
Well, that one's a little bit age or stage of life dependent because that can be a low estrogen sign. Sometimes if that's during kind of the perimenopause or menopausal years, then and it might, even if they're not noticing it, I'd be curious. Sometimes it can even be like a little flush of heat that might happen right before that waking, and that can kind of bring you out of sleep. So I would probably look at estrogen levels first. If that's not a factor, or maybe this is a woman in her 30s and normal cycles and all of that, then, I would I would look at the adrenal piece because that might be a cortisol spike that's happening earlier than it should.
Right. That's what I thought immediately, but what do I know?
No,
this is not my expertise. I'm learning, but I have a long way to go. And it's all interconnected, isn't it? I mean, it's like when cortisol goes up, insulin goes up and estrogen goes down. It's just a never ending interconnected scenario.
Totally. It makes it complicated, but fascinating at the same time.
Yes, it does. Okay. So this is from a woman who is cycling, and she writes, I'm confused about the best way to take progesterone. I thought menstruating women were supposed to take it from day 14 until their period, but my doctor prescribed it for 3 weeks on and 1 week off with no mention of my cycle.
Yeah, that's okay. Yeah, it gets a little confusing there. In general, if a woman's still cycling and we're adding some progesterone, maybe for PMS or difficult periods or something, then generally it is recommended to do like day 15 through 28 as the cycle. So, and if the cycle's regular, that's great. So you can just stick with that until cycles become irregular. Now, if that's not doing the job and there's still maybe some difficulties around ovulation or a very intense PMS or difficult periods, sometimes I might back that up a little bit, but it's kind of case dependent. But the short answer is yes, if you're cycling, day 15 to 28. If you're not, then it's generally, all month long with maybe 3 days off at the beginning of the month. Or if your cycle's all over the place, then I would just say, take it every day until you start to bleed, then take 5 days off. That's kind of my
beautiful.
Even though I'm not your doctor, that's
right. You won't be held to this. Yes, in general. I love this. Yeah. Okay. My DHEA and testosterone, a woman writes, are almost non-existent. I tried to supplement DHEA at 2.5 milligrams a day and was completely bonkers, agitated, and irritable. My doctor said I wake up every day with no gas in my tank, so I'd like to know how to put some gas in my tank without reacting so strongly.
Yeah, so that might be, this is the situation where we're going to want to start at the very foundation. Sometimes supplementing with end organ hormones like DHEA or testosterone or estrogen, it's jumping the gun a little bit. Like we have to, those are kind of like, talk about those as like the icing on your cake, but we need to bake the cake first. So if you're, going to be, if it feels, like it's too soon to go there, or like the foundation's not laid, then I think something more gentle like ashwagandha, doing that maybe morning and evening, maybe a little bit of maca, which can be nice and can help even with the testosterone issue. Just a little bit of that, start in the morning and some at night. Other gentle adrenal kind of repair, licorice tea can be really nice to sip through the day. Whatever the body's kind of responding to. And then of course the lifestyle pieces of course are always important, but I would focus more on like helping to build back up adrenal, like build back up that gas tank from underneath. And then it might be that DHEA will just rise on its own, or you're going to react better to kind of layering that on there. So.
Right. And my understanding of DHEA sometimes is if we're already stressed, you've got that, what is it called? Not the progesterone, the pregnenolone steal,
Yes,
right?
right.
So if you're taking DHEA, one of the pathways it could go down is cortisol, right? And
Yes.
that could be driving more cortisol, which is actually not what you're trying to do,
Good point. Yes,
right?
exactly. Right. So again, it's about regulating the cortisol,
Okay.
something like cortisol manager is something that we use a ton of from integrative therapeutics. And then, any variety of those adrenal, like that Gaia adrenal, there's one called HPA adapt from integrative that I like, or adrenaline from Claire Labs. Like they're all kind of that, they're just like formulas to feed the adrenals. Vitamin C actually is another one that gets overlooked. The adrenal glands are the biggest users of vitamin C
Is
in the
that
body.
right?
They suck it up. That's why if IV therapy is an option for somebody and they can do a nutrient IV, like a Myers cocktail, the adrenal glands just like suck vitamin C up like a flagging plant. And that can be a nice way to do, if we have a wish to do everything, I would have a woman in that situation do like 6 Myers cocktails over the span of 3 weeks, just to kind of like to water the plant. And then, then maybe add on other things. But
I love it. I love it. It's a replenishing kind of protocol to really rebuild and replenish. And that sounds so nourishing. Somebody asks, what drives variability in cycle length? I've ranged between 19 and 32 days over the past few months. What's going on?
Okay. That's a good one. So the short answer is ovulation, right? So you can still have a cycle, but not necessarily ovulate. If you do not ovulate for whatever reason, menopause, high stress, lots of influences on whether the actually, where the ovary actually releases a follicle. If we do not ovulate, then we don't make very much progesterone in the second half of the cycle. And it's progesterone that determines how long it's going to be before your uterus sheds that lining. So progesterone is the real answer, but it's related to ovulation. And that's a big change that happens. And that's perimenopause, is that kind of irregular cycle, because we start to kind of wind down our cycle of ovulation, or our regularity of ovulation. So progesterone bioidentically can be really helpful for that if it's indicated.
Interesting. Well, thank you. So it sounds like more investigation might be needed there.
I would, because there's something is either it's age appropriate, right? Like 40s, that's just what starts to happen.
Yep.
Or there's something that's getting in the way of a regular ovulatory cycle.
Yeah. I think 40s is the accurate answer there.
Okay.
So this one, on the other hand, is from a woman in her mid-20s. And I love this because this woman is on her health and working to correct some imbalances and fertility stuff. And she's working to clear parasites and heal her gut. And she's being very diligent. And she writes, I used to never get emotional before my period. Some cramps, yes. But now that I'm healing my gut, my husband and I have both noticed that I'm getting a little bit snappier before my period. I'm not sure that was her actual quote. Do you think this is because of the parasite cleansing or gut healing? Or are my hormones actually getting in better balance, or are they becoming more imbalanced? This is a conundrum. So what's going on with this woman?
If you like the snappiness part, then that's okay.
Right.
Then your hormones are getting better. My first thought about that would be that when we're doing parasite treatments and a lot of these gut things, that those treatments tend to be kind of energetically hot. And from a Chinese medical perspective, the liver is, for women, that's the big seat of our hormone like regulation, and also our emotions, especially irritability. So my thought, if you're in the midst of a parasite kind of cleanse, and those can take a while, there could just be that your liver is getting kind of activated and a little bit congealed or congested, what we call. And so, and that can then be playing out through your hormones and the mood. And that's going to get worse right around the time of your period, because you're going to be a little bit estrogen dominant and the liver is going to struggle. So, there could be other factors there. It could be that you are that she is in a re-regulating phase and it's going to be a little bit rocky. But I predict after the parasites are all cleared out and the gut's balance is going to take care of itself, and just maybe some magnesium in the meantime. And
beautiful.
Yeah.
Beautiful. I think she's on that.
Good.
So here is another question that's maybe similar, because when I think parasites, I think full moons. And this question, not parasite related, but it says, does the full moon affect our hormones? And she writes, if I lose it, it tends to be around the full moon. Plus, for years now, I felt tired, weaker, and a bit low around the autumnal equinox.
Interesting. So the full moon and probably the equinox are so, like, if a woman's on a moon cycle with her cycle, which we ideally are, but not always, especially in cities, then that should be around the time of ovulation, and which is right when we get kind of a peak of estrogen, and then it starts to decline. So my sense is that, and there's probably a better kind of astrological answer to it all, but my sense is that there's probably something happening with that estrogen drop that's happening right at ovulation. And so maybe some support, like some maca or some Vitex or something to help kind of smooth that out. Because it sounds like, and especially, it's great that we're sensitive to like the phases of the moon and all of that. I think that's a great thing for us. But if it's problematic, then that's just kind of showing you that there's something going on in the cycle that needs support.
Perfect. I love that. And this woman is really in tune, so that's going to resonate, awesome. I'm sure. So here's another one. How does breastfeeding affect hormones? Could it be that my morning temperature is 37 degrees, obviously from somebody not in the US, because I'm still breastfeeding? Does that mess up hormones?
Well, it does muddy the picture, right? Because you have all that prolactin and the oxytocin, and your estrogen is actually pretty low during breastfeeding. So I wouldn't necessarily use that data to interpret that as a thyroid or an adrenal disorder. Like we're supposed to run a little hotter, right, during breastfeeding. So
got it.
Keep that baby warm. So
that makes perfect sense. So beautiful. Yeah. And last but not least, I love this question. I think you know where I'm going. When I talked to my older colleagues, they told me you better not take any hormones because they're not good for your body. Are there any side effects if you bring your hormone levels to what they should be? And could bioidentical hormones harm your body? And finally, she writes, this is all one paragraph. Could somebody get pregnant even into their 60s?
Okay. Yeah, we could do a whole segment just on that.
And we've got, and I just want to give you a 5-minute warning because it's already 11:53 and I know you've got a patient coming up.
Okay. But this is also such a fabulous question. It's kind of like the crux of my mission with bioidentical hormone therapy. So I'm so happy to answer it. First of all, if hormones were bad for us, we'd all be in trouble, right? Because we make hormones our whole lives and they start to surge in puberty and we make a ton of them, right? All the way up until they start to decline. So our hormones are our friends. In postmenopause, when our estrogen, progesterone, testosterone decline, we feel the impact of that. And that can be not great for our quality of life now and B, our long-term health as far as our heart, our heart health, our brain health, and the strength of our bones. The data that hormone therapy is bad for us dates back to about the year 2000 when the Women's Health Initiative, a big study came out where like all these women got like terrible side effects from their hormones and had heart attacks and strokes and got breast cancer. And that was kind of like, before that, women were given their Premarin and Provera as soon as they, hit a certain age, whether they wanted or not. It was very common. What happened with that data, and I'll try to be succinct, that study is that in the years following that, all of that data coming out, it was all re-looked at and found that it was the form of hormones that was the problem. The mare's urine, the horse urine that was used to make Premarin, the very synthetic progestins that were used in Provera were given to women who shouldn't have even been on hormones, and they should have never been taking oral hormones. So the whole study was essentially pretty flawed. However, it really infiltrated the mindset of, medical training and the media. And so that's what you still have. You still have kind of, 20 years later, you have some of the fallout of that. What we have learned since then with many, many good, reproducible studies is that bioidentical hormone, when it's done correctly, is not only safe, but really beneficial. And when you weigh out the risks of the disease of chronic aging versus the risks of using hormone therapy now, you win over here. It's not for everybody, and it's something that should be done by a skilled practitioner who uses the form that is going to be best absorbed and metabolized by the body. But in the end, I believe colleagues in that pretty closely, because the safety of our patients is really important, that it's a benefit to almost all women. And if we want to age well and stay healthy and be vital when we're 80 and 90 and still voting and all those things, then we want to really keep ourselves in optimal health. So and it is not the goal for any woman on hormone replacement therapy to get her period. So that can be the confusing part about pregnancy. Sometimes that happens, but it shouldn't. And after menopause, we don't ovulate anymore. So pregnancy by any natural means is impossible.
Won't happen. So no concern about that. And I have come to the same conclusion from all of my research, is that it's a game changer, a life changer, and can be so protective from anything, autoimmunity, as well as Alzheimer's, for example. And actually some of these autoimmune conditions, people are starting to treat with estrogen and bioidentical hormones. So these things that have been vilified for a long time, it's really important to educate yourself and get the data, right?
For sure. And it's still incumbent. We're still in a stage where it's kind of on us. It's on women, right? To sort of have to kind of carry that to your practitioner or find somebody to do that. I think that, again, that will change. But I think on that one, you're still about 10 years out. So for us now, it's worth pursuing.
Well, this has been such a delight, and I'm afraid we're almost right up against your hour.
Perfect.
So I just want to say thank you from all of us for your wisdom and just how much passion you obviously have. I love, you're gesturing with your hands and you're just clearly passionate about this. I want for people to be able to reach out to you if they want hormone support, or at least find and work with somebody who is skilled in the fine art of bioidentical hormones. If that's a path that you want to go down, I highly recommend it. Any final thoughts you have to add?
It does not, it serves the planet for women to feel well. And, and I won't get on a soapbox or anything like that, but I will just say that all of us having access to our full level of health and vitality is so good for everybody. And it breaks my heart when I hear women say that, I haven't felt well for years, or I don't know what's going on. Maybe I'm not, then women blame themselves. And I just want to make that plug that often it's not your fault. There's something going on, and very likely something can be done about it. So it serves you, it serves your family, it serves humanity to, try to figure it out and just be healthy and go do your thing, because we need you.
We need you. I love it. Oh, it has been such a pleasure and privilege talking with you. Thank you so much for joining me. I can't wait to talk with you again and see you in person, hopefully soon.
Yes, me too. Yeah, thank you. Thank you for letting me go on. It's my...
Go on. This was brilliant. We could talk for hours. I loved it. Take great care of yourself and look forward to the next time.
Okay, me too. Okay.
Bye for now. And that's a wrap. Thanks so much for tuning in. If you enjoyed this episode, be sure to subscribe, share it with your friends and family, and if you feel inspired, please leave a quick review so other people can find it too. Now, if you want to beat autoimmune and thrive, make sure you sign up for my free video training at freeautoimmunetraining.com. That's freeautoimmunetraining.com, and watch the first video right away. Take good care. Bye for now.